Hello. My name is Kimberly Henderson, and I am a second-year midwifery student. And I want to talk to you today about the fact that women that are giving birth or are pregnant now are statistically more likely to die than their mothers were when they were pregnant and giving birth. I know this is a shocking statistic, and the reason it's shocking is because we are in one of the most wealthy countries in the world, and we spend the most statistically on healthcare of any country in the entire world, and yet we still have a very high maternal and fetal mortality rate. There are a lot of reasons for this. I myself was almost a statistic. I moved in the middle of my first pregnancy to be where my future husband, the father of my child, was, and subsequently I lost my health care, and I had to reapply for Medicare in a new state and didn't have the money to buy out-of-pocket health care. So I was about halfway through my pregnancy before I even got any health care, and this might be part of the reason I developed a condition known as preeclampsia, which is a very serious condition. Basically, some of your organs start shutting down. So I could have been statistic very easily, and that is why I'm very passionate about this project and also about midwifery in general, and hopefully helping other people avoid that fate. I've also seen terrible things as a doula. I've seen a lot of racism, just not just covert racism, but very blatant racism. There's obviously also a lot of covert racism that happens in our healthcare system. So that creates a lot of stress for moms and sometimes bad outcomes. I've seen people have to rely on crisis pregnancy centers for their care. And obviously that isn't great either because they're not actually medically trained. So people are looking for better options. They're looking for alternatives because our healthcare system is very broken. Modern women are looking for choices, something besides the sterile hospital experience. And especially since COVID, there's been a growing rate of home birth and out of hospital in birth centers births. People are citing that they want something besides the sterile cookie cutter environment. They want more personal care. They want someone that'll actually listen to them. That is a thing that over and over again gets repeated, that women say, my doctor does not listen to me. And that is part of why we have such a terrible maternal crisis as well. And so people are asking, are these alternatives safe, however? And according to a study out of the Oregon University, yes, they are indeed safe. They actually, for a low-risk mom, it actually may be safer to have an out-of-hospital birth because she will likely not have all the interventions that she would have in a hospital birth necessarily. So according to that study, it stated that women that are low risk would be safer. So I think that is very interesting. According to the World Health Organization, we need at least 1 million more midwives in the world to deal with the maternal healthcare crisis, which is not just in America. We hear about it because we are American, but around the world we are facing shortages of people who can safely deliver babies and have been trained in emergency techniques and all the things you need to know. In America, though, however, another contributing factor to our maternal healthcare crisis is at least 30% of, according to the March of Dimes, at least 30% of counties in America don't have any midwives, OBs, birth centers, or hospitals that have delivery units. So that is a serious problem too. So there's a lot of women that are facing maternity healthcare deserts, just like a food desert, but for maternity healthcare. So the main problems that we're facing is like a shortage of practitioners. We're facing women not being listened to. We're facing deep systemic racism, which even when corrected for levels of poverty, education, status, we're seeing like even women of high status that are Black or brown are facing much more dire outcomes than their white counterparts. When we factor all of this, we realize that we need to train more midwives. So that is something that I am very passionate about, and I hope that I can be part of the solution. Thank you for listening.